The investigational drug alvocidib is a best-in-class inhibitor of cyclin-dependent kinase 9 or CDK9. The expression of many critical genes involved in cancer is controlled by stretches of DNA called superenhancers, which recruit a complex of proteins that turn on the expression of many cancer-driving genes at high levels. CDK9 is a central protein in the superenhancer complex. Alvocidib can suppress superenhancer-driven gene expression by inhibiting CDK9. One protein tightly controlled by CDK9 is myeloid cell leukemia 1, or MCL1, which prevents cells from entering apoptosis. MCL1 is critical in the development and progression of acute myeloid leukemia, or AML. Expression of MCL1 leads to chemotherapy resistance. Downregulation of MCL1 by alvocidib places leukemia cells in a heightened state to respond to apoptosis-inducing agents such as cytarabine. Alvocidib used in time sequential therapy has generated promising and consistent activity in both newly diagnosed as well as previously treated patients with AML, including superiority over 7 and 3 in frontline patients with poor risk features. In normal cells, MCL1 is tightly modulated by the protein NOXA, which interacts with MCL1 leading to the induction of apoptosis. Cancers with a dependency on MCL1 have levels of MCL1 that exceed NOXA and prevent cells from entering apoptosis. Patients whose cancer is dependent on MCL1 can be identified by an assay called NOXA Priming. NOXA Priming introduces exogenous NOXA peptides to antagonize the MCL1 survival signals. Patient samples that show sensitivity to NOXA Priming are dependent on MCL1. Data from AML patients treated with alvocidib have shown that NOXA Priming can identify patients with a high likelihood of responding to alvocidib. The correlation between high NOXA Priming and response to treatment with alvocidib suggests its ability to potently inhibit CDK9 and concomitantly downregulate levels of MCL1. Tolero is conducting a randomized phase 2 study in previously treated AML patients with high NOXA Priming to further validate the sensitivity of these patients to treatment with alvocidib.